Factor V Leiden is a genetic mutation that affects blood clotting, making individuals more susceptible to developing abnormal blood clots. It's one of the most common inherited conditions linked to venous thromboembolism, which encompasses deep vein thrombosis and pulmonary embolism. About 5% of the population in the United States carries this mutation, yet not everyone will experience complications. This condition is named after the city of Leiden in the Netherlands, where it was first identified in the 1990s. To understand Factor V Leiden, let's explore how blood normally clots. The clotting process is complex, involving various proteins and factors that work together to stop bleeding. Factor V is one of these proteins, and it plays an essential role in the clotting cascade. When a blood vessel is injured, Factor V is activated and helps to convert prothrombin into thrombin. Thrombin then facilitates the transformation of fibrinogen into fibrin, which is critical for forming a stable blood clot. In individuals with Factor V Leiden, if this mutation is present, the activated Factor V protein is resistant to a natural anticoagulant called activated protein C in normal conditions. Activated protein C helps to regulate blood clotting by inactivating Factor V and preventing excessive clot formation. However, with the Factor V Leiden mutation, the regulation is impaired, leading to an increased risk of developing clots as Factor V remains active for longer periods. Individuals may inherit one or two copies of the mutated gene. Those with one copy, known as heterozygous carriers, have a moderately increased risk of clotting events. In contrast, individuals carrying two copies, referred to as homozygous carriers, face a significantly higher risk. Risk factors for clotting include long periods of immobility, use of estrogen-containing medications such as birth control pills, pregnancy, surgery, and obesity. Symptoms of Factor V Leiden complications can manifest as swelling, pain, and redness in the legs, indicative of deep vein thrombosis. If a clot dislodges and moves to the lungs, it can result in a pulmonary embolism, presenting symptoms like sudden shortness of breath, chest pain, or a rapid heartbeat. Because these symptoms can indicate serious conditions, immediate medical attention is essential. To diagnose Factor V Leiden, healthcare providers may conduct a blood test to identify the presence of the mutation. This can be part of a broader thrombophilia workup, particularly if there's a personal or family history of unexplained blood clots. It is important to note that the presence of Factor V Leiden alone does not mean that an individual will definitely develop blood clots. It is one of many contributing factors. Management of Factor V Leiden mainly focuses on reducing the risk of blood clots, especially after known risk factors or events like surgery. In these situations, doctors may recommend anticoagulant medications as a preventive measure. Long-term treatment decision depends on the patient's history, the presence of other risk factors, and the type of thrombosis experienced. Individuals diagnosed with this mutation are often encouraged to maintain a healthy lifestyle, manage weight, stay hydrated, and avoid prolonged periods of immobility. Living with Factor V Leiden can also involve decisions about family planning, as pregnancy and hormonal therapy can increase the risk of clotting. Women with this condition should consult with healthcare providers for personalized strategies to minimize risks during pregnancy or while considering birth control options. In conclusion, understanding Factor V Leiden is crucial for both individuals affected and healthcare professionals. Awareness can lead to proactive strategies that manage risk and maintain quality of life. If you suspect you have Factor V Leiden or have a family history of thrombosis, consider speaking to your doctor about genetic testing and comprehensive risk assessment. Remember, knowledge is power when it comes to managing your health, and staying informed can empower you to take necessary precautions. Thank you for watching. Stay healthy and informed, and don't forget to subscribe for more educational content.